I tried to imagine a fellow smarter than myself, and then I tried to think, what would he do?
Charge up your axons, ready your receptors, and shift your lobes into upper beta phase. You are listening to Smart Drug Smarts, the podcast dedicated to helping you optimize your brain with the latest breakthroughs in neuroscience, nootropics, and psychopharmacology.
Hello and welcome to Smart Drug Smarts. I am your host, Jesse Lawler, here with an early morning edition. It is not even 6 o'clock as I record this, but I bounded out of bed and was too excited to do anything else other than to record this episode, which actually the interview was recorded a few days ago, so we're just getting to these before and after segments now. But this episode is going to be all about blood work. Blood work is the decidedly unscientific sounding name for the analysis of a person's blood chemistry to give said person a look inside of their own body to see exactly what's going on at a biochemical level and likely make some lifestyle and dietary and supplemental and even pharmaceutical recommendations based on what one finds there. I just had my own blood work done for the first time in a little over 2 years, which is actually longer than a person really should go, probably at my age, between checkup sessions of this nature. I didn't have anything overtly wrong with me, wasn't feeling bad, but as I've mentioned on earlier episodes, I'm about to 1 month and 1 day from today, on February 16th, myself and several other Smart Drug Smarts listeners are going to be doing a 7-day water fast, kind of inspired by the episode with Dr. Thomas Seyfried a while ago, and I wanted to sort of get a look at just what's going on biochemically with me in advance of that. I'm not sure if I'll do another follow-up immediately after. Some of the changes after starving for a week are going to be pretty predictable, and I feel like might not actually tell me a whole lot, but I think before doing anything quite so physically severe, it's probably a really good idea just to make sure that your body's operating somewhat within normal parameters before making any major changes like not eating for 168 hours. But our guest is Dr. Alexis Shields, who is a naturopathic doctor who specializes in blood work. We're going to be talking with her about blood work in general, and there's sort of two ways to consume this episode. There's the short version, which is the one that we've published here as a podcast, but after we sort of talked about general stuff, Dr. Shields and I went very specifically through my particular blood chemistry, and I'm going to make that available on the website, both the spreadsheet file she gave to me that's sort of an example of what a person gets back after having their blood analysis done, and then the full conversation that we had about the specifics of my blood chemistry. So again, if anybody listening is curious as to the level of detail that one gets from one of these blood analysis sessions, then all that will be available. I'll sort of be opening the kimono on my own blood chemistry, but that'll be as an additional download on the website for the people that are super curious about that. If you hang around until the very end of the episode, I'm going to give you some scientific validation why sleeping naked is a very good idea. But before we get into any of that, let's do This Week in Neuroscience.
Smart Drug Smarts, This Week in Neuroscience.
So in one or two of the last This Week in Neuroscience, we talked about Alzheimer's and those nasty chemicals called beta amyloids that cause plaques in the brain of Alzheimer's patients and lead inevitably to irreversible loss of neurons and cognitive downslipping. Now, turmeric, which contains curcumin, which I guess turmeric is the spice and then curcumin is a compound within that spice. But anyway, this is a traditional spice in Asian food, particularly in Indian food, and it's been found to be really beneficial in preventing the buildup of these beta amyloid plaques. And this is one reason that they think that Alzheimer's might be really underrepresented in Indian populations. The problem with just putting on turmeric as a prophylactic measure against Alzheimer's is that you would need to eat a heck of a lot of turmeric, like a heck of a lot. Which if you're going to have Indian food every day of your life, maybe that's okay. But I guess it gets broken down in your gut. A lot of it doesn't make it across the lining of your gut into the body, and then even less will make it across the blood-brain barrier, which is where it's really needed inside the brain to fight these beta amyloids. However, scientists at the Shiga University of Medical Science in Otsu, Japan, have been developing a new strategy based on curcumin to deliver a very similar molecule into the brain of Alzheimer's and pre-Alzheimer's patients using an aerosol delivery that would be inhaled, so like a nasal spray of curcumin. Currently, this is being used in transgenic mouse models, the mouse models for Alzheimer's diseases, and has not made its way to human trials yet. But this seems to be a really effective method of getting this curcumin lookalike compound across the blood-brain barrier. So some pretty promising research.
Smart Drug Smarts.
So as I mentioned, our guest this episode is Dr. Alexis Shields. Now, I'm on a web forum where probably about 3 months ago, maybe 4, I saw Dr. Shields post an Ask Me Anything, saying basically, I specialize in blood chemistry. Any questions you've got, post them here and I'll do my best to answer them. And that was exactly what I was looking for at that point. So I reached out to her and told her both about the podcast and the fact that I thought that that sort of thing would be a great episode. And also that I hadn't had my own blood chemistry done in a while and would love to get that checked up on. So we corresponded bonded for a bit, and we figured we'd do an episode right around the start of the year, and that's what you're listening to. And so the way that this worked is interesting. I've never met Dr. Shields in person, and really all we did is we had a conversation on Skype. She sent me a little PDF form with a couple of things for me to fill out, just like basic, personal information that one would fill out when you first go into any new dentist or healthcare facility or whatever. She charged me on PayPal, so I just sent her some money over the web. She made sort of one of those doctor's request forms for a lab to draw my blood, and then sent me a link to places in my area. At the time I was up in Oregon visiting my family for Christmas, and there were like 5 labs within a couple hours. So I just picked the closest one that had the facility to do the blood draw, called up them, scheduled my blood draw, went in, got it done. The whole process was probably within 25 minutes. I was in and out the door, minus several vials of blood, but really there was nothing too obnoxious about it at all. Just had to fast for 12 hours, I think, beforehand, so that the meal that I'd had the previous night didn't radically affect my blood chemistry. And then the lab emailed Dr. Shields the results, and I heard from her a couple of days later. Literally, this whole thing probably happened within like 4 days, and she had a nicely made spreadsheet with my various biomarkers. And so when we talk about the details of my blood chemistry, which again, we're going to mostly skip in this episode, but that'll be available as a supplemental thing on the site. Those of you who are interested can hear in detail on the level of detail that a doctor like Dr. Shields would go into when you get your blood tested. But let's jump into the general part of this episode where we talk about blood work, what it is, and the reasons why a person might care.
So I graduated from medical school in Portland, Oregon. Graduated as a board-certified naturopathic doctor. And in the U.S., naturopathic doctors are trained as primary care physicians. So we're family doctors who specialize in functional medicine.
And can you break down some of those terms, naturopath and functional medicine?
Basically, what it breaks down to is our education is just like a standard medical curriculum. We learn biochemistry and anatomy and physiology and pharmacology and all the ologies. But in lieu of the hospital rounds and choosing a specialty like becoming a neurologist or a gastroenterologist as medical professionals go on in their career, we are spending the last couple of years of our education learning things like nutrition and botanical medicine and different body manipulation techniques and homeopathy and hydrotherapy. And so our entire goal is to look for a more natural or least harmful kind of evidence-based medicine or natural medicine that might be the replacement of a drug that could potentially decrease the patient's health over time or reduce their overall quality of life. So we're looking for that most effective but least invasive treatment, which oftentimes natural medicine and herbal medicine and things like that has really good solutions for. So it kind of gives us as a primary care a lot of tools to help to identify problems early for patients and help to prevent diseases from progressing and advancing as time goes on.
Gotcha. So sort of trying to aim to be the happy medium between using a pharmaceutical for everything, but not also venturing off into just woo-woo stuff that doesn't have science behind it.
Exactly. A lot of people, they're frustrated because they go into the doctor with a specific health problem, like they have really low energy or their digestion is terrible, or they know that something just doesn't feel right. They don't feel good, so their quality of life is low. But there's not a diagnosable condition that physician can find as part of their problem. And so for these people, they can be kind of out of luck because there's not a lot of drugs for things that are more functional problems and not diagnosable diseases. And so as a naturopath, we have all these tools to help people kind of increase quality of life, identify problems early, and also help conditions that are not necessarily a diagnosable condition.
An example of that would be something like a vitamin deficiency.
Yeah, in conventional medicine, they can identify that as well, like iron deficiency, for example. But a lot of times they're looking at blood work and they're waiting for the blood markers to show a clear and definite iron deficiency anemia is what this patient has, and then they give iron as either in a drug or supplement form. And as naturopaths, we kind of try to identify that early so we can look for more micronutrient problems or look for vitamin deficiencies that are becoming a problem but not a problem yet. So maybe something you can easily fix with diet, whereas if you would have waited 3 years or so, it would have become full-blown iron deficiency anemia. So it's kind of a little bit more proactive.
At this point, one of your areas of specialty is really doing this blood analysis. How did you sort of venture off into that direction?
Yeah, so learning a different way of looking at blood work is a huge part of our education. There's a lot you can do with even very basic blood work in a way that you can look at it a little bit differently. So one of the things that it was kind of an aha moment for me was I kind of grew up with these persistent digestive problems, and I had iron deficiency anemia, and I had some other problems growing up. And before I really had a diagnosable condition, I would go into the doctor, I'd give them my list of things that were going on and I'd get a bunch of blood work. And then the doctor would look through it. They'd kind of look through the right side to see if there was anything that was flagged as being high or low. And because there wasn't at that time in my life, they would be like, well, everything's okay. Everything looks healthy. We'll monitor it again in a year. I was glad that there wasn't something serious going on at that point, but I was also really frustrated because I didn't feel good. My blood work wasn't reflecting that, or I didn't think it was reflecting that. But the truth is, there is a lot that you can see in blood work before it becomes a problem. You can pull out patterns in blood work of things that someone can tweak with their diet or with supplements, or there's ways to identify if your body's too acidic, if you have too much stress in if you're not doing things to help combat stress in your life, if you're not eating the right foods, if you're not getting enough fats, enough vitamins. So actually now that when I look back at my blood work from back then, I was like, oh gosh, there was all these things that had I known how to look for it, then, I would have been able to identify it. And so I look at blood work in a more holistic way, looking for patterns, and I have different ranges for pretty much every marker out there that's more focused on optimal health and not just catching a disease.
Is the sort of analysis you do, would you characterize more as an art or a science? Is this something where if you just fed all these numbers that you're getting out of the lab into a computer, is it an algorithmic analysis, or are you lending your own intuitions and artistry to it?
Yeah, it's a really, really good point. So blood work, it is just a snapshot in time. So we're looking at this small snapshot in time that's spitting out all these numbers. And so the art comes in that you have to interpret this for the individual person. So, there is a little bit of like, could you have an optimal range and see if your vitamin D is within that optimal range? Well, of course, that would be easy to do. But when you're looking at a patient's blood work, you also have to have it in context of their individual situation, because two people with identical blood work, the conclusions to that blood work might be very different because of the person's age, their genetics, their life history, their past medical history, their current living situation. Because all of that has to factor into it, it's a little bit more of an art in that you have to see kind of lots of patients and be able to compare their entire life history to their blood work to really come up with a plan for that person. So in that way, it's not really easy just to plug it into a spreadsheet and have it pop out some answers for you.
In a way, you're the wrong person to ask this question because you're highly biased, but how often do you think the average person should actually be getting their blood work done if they don't have anything that's overtly wrong with them?
If they don't have any chronic diseases, I would say at about age 25, you should start getting some yearly blood work just to get some baselines, because the important thing with blood work is not to get this one snapshot in time. It's to kind of see this progression. And that's where you kind of really catch things, because as they progress and they get worse and worse, or if they're becoming worse and worse, then you can stop that progression from happening. But there are also people out there that are really wanting to optimize health that are also kind of doing regular blood work to really monitor their exercise programs and their diet, and to see kind of how those things are changing their biochemistry. The one thing that I would say is if you're wanting to monitor your health over time, especially your diet, getting a glucometer or a glucose meter is a really good way to kind of get a lot of information about your blood sugar, which is kind of like the foundation of health. If you don't have good blood sugar control and blood sugar management, then nothing else really works right. So it's kind of one of those foundational things that you really want to get a handle on. And if you have a glucose meter, you can really see based on what you're eating, how that directly affects your blood sugar.
Give us the elevator version of the importance of blood sugar and what exactly people are talking about when they're talking about insulin receptivity and some of those sort of core ideas.
Sure. So the entire goal of your body, the whole purpose of eating food basically is to turn it into sugar for your body for energy. So every food that you eat, whether it's protein, whether it's animal proteins, vegetables, fruits, whatever, everything eventually is processed by the body and turned into glucose. It's just every single food is turned into glucose at a different rate. And so when you eat, let's say you eat your breakfast, eventually that becomes broken down, vitamins and minerals are absorbed, and your blood sugar responds. And so basically, insulin is pumped out from your body to kind of unlock those cells so that the nutrients can flood into the cells and feed the cells and become energy, basically, or which will eventually become energy. So when you're testing your blood sugar, what you're looking at is different periods, whether it's your fasting blood sugar when you wake up in the morning or 1 hour after eating a meal, how that affects the amount of sugar that's still floating around in your blood. So at different periods, so 1 hour after you're eating, 2 hours after eating, 3 hours after eating, that level of sugar should be at a certain level. And if it's not, then it's telling us that either your body is not able to adequately put that sugar into the cells. So maybe the insulin that's unlocking those cells is not doing its job. Maybe you don't have the minerals that are needed to put the sugar into the cells. Something is not working. Or maybe you're just eating the wrong foods and it's making that overall sugar level go way too high. And so your body isn't able to keep up.
And at some point, once your blood sugar levels drop low enough, then you'll start doing things like breaking down glycogen or even breaking down fat to go for those energy sources?
Exactly. And fat is a very efficient energy because it can provide a lot more energy than just sugar. So yeah, I think that's a much bigger discussion as far as what sources are the best forms. But as far as diet goes, that's like the overall goal. Break down food, make it into an energy source. And that energy source is you can gauge that with the glucometer.
Let's talk about the brain. What can you find out about the health of the brain and maybe anything that would relate to neurotransmitters or brain chemistry or anything like that from getting your blood pulled?
Sure. So just from very basic blood work, what I would say is that our whole body works as an integrated whole. And so we're not just a bunch of isolated systems. And anything that affects your body also affects your brain, just because everything is so intimately linked. A lot of people, they want to optimize one part of their life, but they fail to kind of look at everything as a whole to see if it's functioning really well. And so with basic blood work, you can look at, is there any dysfunction in anywhere in the body that might be taking or adding stress onto my body and taking off the focus of other areas. And so, for example, if you have chronic digestive problems, constipation, diarrhea, lots of bloating, maybe you have heartburn, any of these things that are kind of a chronic stress on your system, then if you're trying to optimize health, especially your brain health, there's a stressor on your system that's going to be draining your stores and draining your ability to really optimize other areas of your body. So it's kind of looking at the basis of health. How's all your organs working? Because that affects everything, really.
Yeah, super foundational stuff. Your brain is probably the top of the pyramid as far as your physiological energy needs and things like that. So if anything lower on the pyramid isn't working right, it's going to have adverse effects on your brain and cognition.
Exactly. And then one thing that I see have a huge effect on brain health is looking at cholesterol. And I think there's a lot of misconceptions about cholesterol and what it does for your body, and that you want to always lower it, and lower cholesterol is better. And that's not necessarily always true.
Cholesterol's been demonized historically. Like when I was growing up in the 1980s, it was the next worst thing to the Nazis was cholesterol. And now it seems like that there's been a big sort of sea change on people's opinions about cholesterol and HDLs versus LDLs. Where do you come in on that?
I really don't believe in the so-called good and bad cholesterol, describing it in that way, because all cholesterol is good in the right amounts when it's doing its proper function. And so the quick and dirty example is so LDL cholesterol is the so-called bad cholesterol. And the only reason it's called that is because it's taking cholesterol that the liver makes and it's bringing out to the tissues of the body. The thinking behind saying that's bad is because it's taking it from the liver and bringing it out to the body, which in excess amounts can be detrimental to your health. And then HDL is what brings that cholesterol from the tissues in your body back to the liver to be metabolized and changed, and so or recycled even. So that's considered the good cholesterol only because it's bringing it back to the liver and it's not staying out in the body. So they originally kind of explained it in that way just because it's telling you, is it going to the liver from the liver? But we now know that cholesterol is crucial for brain health. It's crucial for creating all the hormones in your body, for neurotransmitters, for like every hormonal process in your body. You must have adequate cholesterol to make those hormones. It's one of those things that, when somebody goes on a statin drug to lower their cholesterol or any cholesterol lowering medication, some of the first things that you notice is that your brain health and your ability to remember things, your attention, your motivation, all of those things are affected, because it very quickly can change your biochemistry in your brain and just the fat content in your brain, because your brain's about 60% fat. The other thing with cholesterol is you need it to go out to the body from the liver, because cholesterol is kind of like the duct tape of the body. It floats around, repairs damage. And if you don't have adequate cholesterol to repair that damage, to recreate tissues, then that's when really big chronic health problems can happen.
Based on all the studies you've done, it sounds like you have a big nutritional interest as well. Like, how's your own personal diet?
I don't follow any one particular diet. I listen to my body. I know what to look for. I regularly test my blood. I know exactly what symptoms happen when I eat certain things. And so from trial and error, I've come to the fact that eating good, healthy, good quality animal proteins, lots of vegetables, good, healthy fats, limiting things like sugar, obviously, but also dairy products because I'm lactose intolerant, and also excessive amounts of grains, especially gluten-containing grains. I have an autoimmune disease, and so eating gluten-containing grains is like adding the fuel to the fire for an autoimmune disease. So that's kind of the basis, which looks like a modified version of a paleo diet, if you wanted to compare it to like a modern diet that's really popular now. I think the paleo diet has done really wonderful things for people just because it gives them a lot of resources for eating just really good, whole, solid foods. That's where I lean towards anyway.
Could you talk a little about the difference between processed sugars and things like honey or fruit sugars, some of these natural sugars? And I hear a variety of things like, I like sugar. I love fruit. I would love to continue to eat fruit with a clear conscience. But you'll hear different things sometimes like, well, it's a good sugar. You don't need to worry about it. Or, well, sugar's sugar and you still do need to worry about it. Where's the science on that right now?
You know, I think the reason why it's kind of all over the board with that is that it's so individual, and there's certain foods like fruit sugar, honey, also things like coffee, like caffeine, tea, chocolate, that are kind of these like gray area foods where some people process them fine and everything works great and their blood sugar stays stable. They don't have any chronic diseases that they're dealing with, that it flares up, and they do fine on those things. And then some people, it's totally their poison. So it's for one person, it's totally fine. And then the other person, they respond to it terribly. So someone that has problems with yeast or chronic yeast problems, for example, fruit sugar and honey and maple syrup and these kind of things are not usually tolerated as well as for some other people, where they just tend to doing it in moderation is no big deal. So I think it depends on where you are in that spectrum, what your health history is, what kind of chronic health problems you're dealing with, and just making sure that you're monitoring your health so that you know if it's a problem for you or not.
Now, it seems to me that something like blood work would actually be an ideal way to identify some, like, if you had a low-grade allergy, something that's not necessarily going to make you bedridden, but is maybe, taking 10% off your performance. Those kind of things can be really, really hard to identify. It's not that you're eating the same meal every day. And it's like we've all got so many variables in our lives all the time. It seems like a person could easily go through their whole life and not identify some of these things that are slightly whittling down their overall health. How might a person use something like blood work to identify some of these problems that might not be giant problems, but are maybe, again, just taking 10% off their performance?
I think, and that's kind of where this functional blood work shines, because you can see these little changes. If you're eating things that your body doesn't process well, or that you're slightly allergic to or intolerant to is a better word for it, your inflammation levels will go up. And so you can see that in different inflammatory markers. Usually your blood sugar will also be a little bit out of whack if it's been like a long-term problem. And then things like cholesterol, because that's all related to inflammation. So anything that's really related to inflammation can definitely go up.
Okay, so now we're going to jump ahead into the part of the interview where Dr. Shields is telling me about the particulars of my blood chemistry. This is just going to be a quick little highlight reel so you can get the idea, and then we're going to get back into the general stuff.
It's the foundation of health, and they've found with research that every point that your blood sugar rises over 90, your fasting blood sugar rises over 90, your risk for heart disease increases. And so what we're looking for is making sure that your fasting blood sugar is between 75 and 90. And yours is. It's wonderful. There's a couple other markers that I look at. So we look at at the very least, we look at fasting blood glucose, hemoglobin A1C, which is your overall blood sugar over the last 2 to 3 months, kind of like an average. And then I look at your triglycerides with this as well, because when blood sugar stays elevated for too long and you're eating things that like too many carbs that are keeping your blood sugar elevated, then triglycerides tend to go really high. So this is related to blood sugar. And all three of your markers are excellent. You're looking at a very optimal foundational blood work picture. Iron level for women and men, super important. Usually for women, you're trying to make sure that they have enough. And for men, you're trying to make sure they don't have too much. And the reason why is because women have this cycle every month where they can get rid of iron, basically. So with men, however, iron is super important. You need it to carry, oxygen to make red blood cells. So definitely need enough iron.
Clearly, I am not Iron Man because I'm a little bit low on iron.
Well, actually, that's not what that's telling us. So TIBC, it's a binding capacity. And so decreased TIBC and elevated serum iron are kind of telling us that there's maybe an iron storage issue, meaning that you have too much iron, but you don't have that overall picture. So you have to look at this, and you have to look at your blood to see if you're making too many red blood cells, if your hemoglobin go up, if your overall iron goes up. So actually, I think this is probably one of those snapshot in time things too, where if we do this test in another 6 months, it will probably be a different range. It could be that you had eaten something at the meal that you had before this test, the 12 hours before, that increased your iron levels. The take-home message for you is really to help to alkalize your body with making sure that you have adequate water intake, making sure that you're getting enough greens. If you're already getting a lot of greens, just kind of looking at your overall, are you getting them 3 times a day? Are you making sure you're getting lots of leafy greens and brightly colored things every single day, twice a day at least, maybe even 3 times? Making sure that you're getting plenty of good quality fats, maybe introducing some cardio because it sounds like maybe your exercise is a little unbalanced. That's the take-home message. And making sure that you have really good cholesterol is probably the most important thing there.
Okay, so now back to our regularly scheduled interview. So if people want to get a hold of you and get a similar series of tests run on themselves, what's the best way of going about that?
I sold my practice in Oregon, my medical practice, and now I work 100% virtually. So I do online appointments, and you can go to my website. It's dralexisshields.com, and that gives you kind of all the information on how to book an appointment, what that looks like, what the different packages are. You can also send me a message to see if this is a good fit for you or if you have some specific needs, and you can read my blog and all that. So it's all on my website, dralexisshields.com.
And for people who haven't worked with an online doctor before, can you make prescriptions and do all the normal stuff that one would expect of a doctor working in a virtual way?
So now that I'm working online, I don't function as a primary care doctor. So I still require people to have their doctor at home that they would go to if they were to get acutely sick and they needed an exam or they needed to refill a prescription. So I'm not doing any prescription medications now. So I do a really collaborative approach with their medical doctor if they have one. And I'm just functioning as coming up with this functional plan as far as diet and exercise and looking at functional blood work and serving that kind of role.
Smart Drug Smarts.
Okay, so thank you very much to Dr. Shields for taking the time for that explanation. This was actually, she might have broken new ground as the longest single Smart Drug Smarts interview. We talked for almost an hour and 20 minutes, which I found super interesting because of my own narcissistic interest in my own blood chemistry. But I think the idea that this is a good thing for a person to check up on is certainly applicable to all of us. When we had Dr. Braverman on, I don't know, maybe 15 episodes ago, he certainly was banging the drumbeat of having brain scans done to know exactly what's going on within your brain. And I agree with that as well. And something like blood work is sort of like the body foundation equivalent of that same idea. And like Dr. Shields mentioned in the interview, I think it's worth underscoring that of all the systems in our body, the brain is the most complicated, the most resource-intensive piece of tissue that we have. And so anything that's going on elsewhere in the body, especially in the major organ systems, that is not functioning properly, is going to have negative effects on the brain by not giving it the resources that it really needs. Dr. Sandra Bond Chapman, who we had way early in one of the episodes, said that heart health is brain health, and I think that could be extended maybe even further to say physical health is brain health, at least so far as it applies to your major organ systems. Oh, and for any of you that want to listen to the uncut version of this episode that really goes into the details of my blood analysis, that'll be at smartdrugsmarts.com/blood-work, which will also be where everything else about this episode is. But if you listen to this episode in the distant future and it's no longer the newest episode on the Smart Drug Smarts list, that'll give you a way to jump there quickly. And now, as promised, the ruthless listener retention gimmick.
Smart Drug Smarts. Ruthless listener retention gimmick.
So it turns out that there's a bunch of different reasons why it makes sense to sleep naked. Probably the first and least surprising one is the one that will make you all giggly. It's the fact that if you're sleeping naked and you're with somebody who you like, this only works if you like them apparently, but skin-on-skin contact between people that like one another releases oxytocin, which has a host of good benefits. It's kind of the trust drug that our bodies naturally release and gives us feelings of well-being. This is the chemical that's released in huge quantities when mothers give birth to children that helps sort of biochemically bond the mother with the child. It's the chemical that we get when we hug people. And it turns out that it lowers blood pressure and it makes us happy and it boosts the immune system. So a lot of good things about oxytocin. Also, and probably not surprisingly, a study of 1,000 British adults found that couples who sleep naked have a significantly higher chance of being happy with their relationship. 57% of nude sleepers were happy, whereas only 43% of nightie wearers and 48% of pajama wearers were happy. Honestly, I have no idea what the difference between pajamas and nighties are, nor do I want to know after reading this study. But that's not really the most interesting or surprising thing. It's actually sleeping naked gives your body a much better ability to control its own temperature. And your body temperature needs to drop about a half a degree before you can fall asleep. Your core body temperature is at its highest at about 11 p.m. and its lowest at 4 a.m., said Dr. Chris Idzikowski, who's the director of the Edinburgh Sleep Center and the author of Sound Asleep, the expert guide to sleeping well. So you don't want to be too cold, but if you're all bundled up, then your body's ability to shed that extra heat and help you sort of drop down into a comfortable sleeping temperature goes away. It's important not to have your hands or feet too cold, because it's actually, I guess, the capillaries in your hands and feet where your body sends blood to let that radiate heat out into the world to sort of handle this lowering of the body temperature. But if your hands and feet are particularly cold, then the blood vessels there constrict and kind of gums up the body's ability to use them as a heat regulating pathway. So anyway, that's, I think, a total of 3 pretty compelling reasons to sleep naked. And I guess the fourth is that it cuts your pajama budget.
Smart Drug Smarts, the podcast so smart, we have smart in our title twice.
You heard it. That is the episode. If you liked what you heard, please recommend this podcast to your friends and or leave us a review on iTunes. The show notes for this episode, as I mentioned, will be online at smartdrugsmarts.com, including the links to everything that we talked about here. I'll be back at you next week, maybe even less than a week. We do have the next one already in the can and waiting for editing. And of course, I'll be bringing all the usual unflagging commitment to helping you fine-tune the performance of your own brain. Have a great week and stay smart.
You've been listening to the Smart Drug Smarts podcast. Visit us online at www.smartdrugsmarts.com and subscribe to our mailing list to keep your neurons buzzing with the latest in brain optimization. Smart Drug Smarts should be listened to for entertainment purposes only. Although some guests on the show are medical doctors, most are not. And the host is just some random guy. Nothing you hear on this podcast or read at smartdrugsmarts.com should be considered medical advice. Consult your doctor and use some damn common sense before doing anything you think might have a lasting impact on your brain.